to us how will the practice of medicine be impacted if Congress fails to fix the Medicare physician payment system?
Well, if they fail to and continue simply doing what's been done, namely masking the problem, all we're doing is putting off the inevitable. I mean, this year, as you mentioned, we anticipate a 20% cut if it is not resolved. That will be 40% the next year. If you carry that to its logical extension, if Congress continues simply to apply a patch, that means by 2012, all the medical practices in this country are to be cut by 160%. I mean, that's obviously utterly absurd. So even today, if you were to cut it by 20%, I think you can say, and this is not hyperbole, I don't think any primary care practice in this nation could survive a 20% cut in those revenues.
Thank you. Dr. Heyman, the Medicare Advantage program costs the federal government about 14% more to provide benefits than traditional Medicare. The President believes the funding could be put to better use. Can you tell me where the medical community sits on this issue? And I would like to hear from Dr. Harris and Dr. Presky and even Mr. Hannon.
Well, at the American Medical Association, our feeling is that these are enormous supplements in payment to Medicare Advantage plans. We're not opposed to Medicare Advantage plans, and we certainly are not opposed to people having the choice of regular Medicare or a Medicare Advantage plan. We just feel that if a Medicare Advantage plan was as efficient as Medicare is, then Medicare Advantage plans would be able to exist without those kinds of supplements. And so we think an efficient Medicare Advantage plan is a wonderful idea. We just are opposed to giving them extra money to provide the same services.
Yes. Dr. Harris.
The American College of Physicians would echo that sentiment. Again, we're not opposed to Medicare Advantage. What we would like is the various Medicare options that patients have are on a relatively level playing field.
The American College of Surgeons also has no issue per se with Advantage plans. The intent from the outset was to use a business model for insurance industry, as I understand it, to provide more efficient care for Medicare recipients. We can't demonstrate that that's necessarily occurred. The President's budget proposal talks about comparative effectiveness research and sets aside money to do this, to figure out what is a value-based purchasing. And hopefully Medicare Advantage plans will be driven to demonstrate a value in this purchasing. I don't believe we're there yet, and I would have to agree with my colleagues.
Mr. Hahn.
Madam Chairman, as a small rural hospitals, we don't see the effects of the Medicare Advantage program in our communities as much as our urban counterparts do. As hospitals, it is not necessarily the program that's administered to us that makes a difference. It is where is the money being put to use. If it is, in fact, an efficient program, whether it's the Medicare Advantage program or any other one, our efforts are to ensure that patients get safe, appropriate care efficiently, and that the money is going to help assume that the patient is getting the care and not the insurance companies.
Thank you. Dr. Harris, the ACP supports incentives for physicians who adopt HIT. However, there is concern over possible penalties for small and rural providers. Given the unique needs of these practices, how do you think we should address the issue of HIT?
Well, excuse me, this is a major issue. I would just preface it by saying that 82% of all the office visits in the United States are to practices with 5 or fewer physicians. I mean, these are huge issues for small businesses. And HIT, the cost of it is just an enormously steep hill to climb. As most of you are aware, the cost currently for a physician to add this technology to his or her office is about $35,000 to $50,000 per doctor. And then after that, it's another $5,000 per doctor per year to maintain the software. So obviously, with these groups of 5 or more, or 5 or fewer, it's just a huge sum of money to try and find someone to loan you the money to go out and try and purchase the system, which is so utterly essential if we are going to make this seamless connection, which we will believe ultimately will help reduce health care cost.
Thank you.